Bismillahirrahmanirrahim. Today we will be discussing the functional components of the cranial nerves. But before going to the details of the topic, we are supposed to learn some facts about the embryological origin of all this. You are looking into the neural tube having the neuronal canal, and it's being lined with the neuroepithelial cells. This neural tube from inwards to outwards composed of 3 layers. Now in this very picture you can see these 3 layers. In the very center you can observe the central canal. In this respected cut section of the spinal cord, you would say, the innermost lining labeled as neuroepithelial layer is also called as inner ependymal layer. Then next to it you can see the mental layer, which in future will be forming the gray matter in the H-shaped letter or butterfly shape. It is divided into 2 plates rather. The posterior or dorsal located plate is called as alar plate, which is sensory, you would say, and the ventral located basal plate, which is anteriorly located also, you can mention it, and these both are being divided by the sulcus limitans. Now, on the outer side of the mental layer, you will be observing the marginal layer, the future white matter of the spinal cord. Now you are looking into another diagram, transversely cut view of the brainstem, you would say, near the medulla oblongata. Here what is going to happen that as we have seen, the same arrangement which we observed in spinal cord, medulla oblongata will be also showing the white and gray matter. But due to the extensive rearrangement, due to the embryological development and the expansion of the neural tube, what is going to happen? The fourth ventricle is supposed to be formed, and you can see the lateral extensive spread of this fourth ventricle results in the alteration in the, you would say, the positioning of the alar and the basal plates. Now for this, if you focus the area present or marked with the darker oval shaped you would say efferent nuclei location or medially location is showing the basal plate, and the lateral area that is showing various afferent you would say location of the cranial nerves is this alar plate. It means the alar plate and the basal plate now has arranged themselves a little bit ventrally, but the alar plate occupies on both sides the lateral position and the basal plate occupies the medial position. Now look into the picture. Now please concentrate again on the picture in which I have marked them with the arrows. The yellow arrow is in the fourth ventricle, and you are looking the pink arrows laterally representing the area of the alar plates, and the green marking are for the area of the basal plate, you would say. So basal plates have taken the medial position and the alar plates have taken the lateral position. Now another important thing which we must not miss is that which components are particularly found in the spinal nerves as well, which are 31 pairs if you can recall. So there are 4 components particularly found over there. They are journal somatic afferent and journal visceral afferent, then the journal somatic efferent and the journal visceral efferent. It means that the 4 components which are particularly found in the peripheral nerves are starting with the general word, either afferent or efferent. So remember, all 4 fibers are general. Let me repeat: journal somatic afferent, journal visceral afferent, general somatic efferent, and general visceral efferent. Now, in the cranial nerves, the other functional components specially are added. They are as a word depicting the special. So their name starts with the word special. So you can see the special somatic afferent and special visceral afferent. And on this side, you can see the special visceral efferent. So these three are added components in the cranial nerves in addition to the last four we mentioned in the spinal nerve. This special visceral efferent, I would say a special type of general of an army officer. If you want to recall, it will be depicting the special as well as general somatic efferent fibers. Now you are looking into a picture in which above there is a lateral alar plate and the medial basal plate. The alar plate is showing all the afferent fibers, and the medial plate is depicting the efferent fibers. And as we know that in the spinal cord, the gray column was in a form of a compact column in the very center of the gray matter, you would say. But now what is going to happen, that each column has to break up into small pieces of fragments to form various nuclei of the cranial nerves. So that is why we expect almost in every cranial nerve they carry these afferent and efferent component. So the flow chart that is being shown in the lower portion, we have to concentrate on it. From the right side of the screen, just concentrate first on the special somatic afferent marked with the darker black line, that is showing the vestibulocochlear nerve nuclei that carry special sensations from your ear concerned with the hearing and the equilibrium. And some books do write that they carry sensory information from the your eye and nose as well. So cranial nerve 1 and 2 should be included here to pick the sense of smell and vision. Next to it, you are looking into the next column showing the general visceral this general somatic afferent fibers. Now what are they? They are carrying the proprioceptive and exterioceptive sensations from the muscles and skin of the head. It means they are taking information from the structures that are being derived from the somites. So such nerves includes the fifth nerve, and they mentioned that 8th, 9th and 10th also carry exteroceptive through these receptors from your ear and tongue. Information are also being passed from these nerves, and they are also the part of this general somatic afferent fibers. Now concentrate on the third column, that is showing the this general visceral afferent and the special visceral afferent. So in the general visceral afferent, they basically supply the sensory fibers, or they call it as interoceptive, to the mucous membrane and the blood vessels of the viscera, and that include your pharynx, tongue and GIT. So 9th and 10th cranial nerve is the part of this column. And they also mention that this special visceral afferent or brachial afferent component, they basically innervate the taste buds that are being derived from the brachial arches in your tongue and the part of the soft palate and your epiglottis as well. So the cranial nerve 7th is a part of it. You can see the nucleus of the tractus solitarius or solitary tract, it is being mentioned. Now concentrate on the general visceral efferent fibers, which are now coming under the heading of this basal plate, you would say. Now what they are having with it. Number 1 is showing the nucleus of the third cranial nerve, Edinger-Westphal. These are basically what they do, they innervate the smooth muscles, mucosa and glands of the viscera. So parasympathetic fibers are present here, and the intrinsic muscle of the eyeball related to your third cranial nerve, the mucous membrane of the nose and palate, lacrimal gland, and the other two glands like submandibular and sublingual, these fibers are reaching by using the cranial nerve. Seventh, so you are looking the two black dots, the salivatory nucleus. So superior salivatory nucleus, along with it, the lacrimatory nucleus is also a part of it. Now the lower nucleus is inferior salivatory nucleus of the glossopharyngeal or ninth cranial nerve, carrying fibers towards oral mucosa and the parotid gland. Now the 10th, the vagus nerve, showing the dorsal nucleus of vagus concerned with the viscera of your thorax and abdomen. Now next to it, you have to focus on this special visceral efferent fibers, which are branchial efferent. They include the nerves 5, 7, 9, 10 and 11. And how? For the fifth nerve, the muscles of mastication, the tensor tympani, tensor palatii, mylohyoid and digastric anterior belly are the area of supply of the fifth cranial nerve. And in the seventh, you know this is the facial nerve, so the muscles of the facial expression, the stapedius, stylohyoid and the posterior belly of digastric is its area of supply. Then comes the ninth cranial nerve that supplies the stylopharyngeus muscle. Now the 10th one, through superior laryngeal nerve, they supply the constrictor muscles of the pharynx, the levator palatini muscles and the cricothyroid. Now focus on the 10th cranial nerve. Through the recurrent laryngeal nerve, it has to supply all the intrinsic muscles of the larynx except the above mentioned one, the cricothyroid. And now the 11th cranial nerve, its cranial part has to supply the salpingopharyngeus and the muscles of the soft palate except the tensor palatii and the levator palatii. Now come towards the last, that is being marked with the this special efferent, you would say, fibers. They can be written as a general somatic efferent or somatic efferent fibers. And the nerve included here are all pure motor nerves like 3rd, 4th, 6th and a part of 11th, which is you would say this part of the nerve of the 11th also and the 12th. So 3, 4, 6, 11th and 12th. So how we say, they have to innervate the skeletal muscle that arises from the somites. For example, the cranial nerve 3, 4 and 6. They supply the extraocular muscle, and the cranial nerve 12th, first I mentioned, they have to supply the muscles of the tongue except platoglossus. And what about the cranial nerve 11th? It has to supply the sternocleidomastoid and trapezius because the spinal part of accessory nerve is also there. So that was the detail of the various cranial nerve afferent and efferent component and being shown in the chart as well.